Preeclampsia isn't just a pregnancy complication. It can also be an early warning sign for a woman's future heart health. In this week's Ask the Expert, 7 News anchor Kelsey O'Donnell spoke with a doctor about the link between the two and what women can do to protect their long-term health.
Meet Dr. Dylan Solis.
I am a maternal fetal medicine specialist.
Dr. Solis is a physician with Bon Secours who specializes in care for high-risk pregnancies, often treating women diagnosed with preeclampsia.
Preeclampsia is a serious disease of pregnancy that can affect any organ system, but it involves new onset high blood pressure.
Doctors say preeclampsia typically develops later in pregnancy and is relatively common, but the concern doesn't end at childbirth. Months and even years later, it can have lasting effects on heart health.
Having preeclampsia is a risk factor for later on developing cardiovascular disease or peripheral vascular disease or even stroke. And probably about 20% of patients will eventually go on to develop chronic hypertension or chronic high blood pressure within the next 15 years after delivery.
Symptoms can also vary widely and in some cases be overlooked.
The ones that we think about most would be headache, especially one that's not relieved with medication, sometimes vision changes or right upper quadrant pain where your liver is situated.
According to the American Heart Association, women with a history of preeclampsia are considered a higher risk for developing cardiovascular disease, making it important to tell your doctor and begin screening early.
That way they can ask for an individualized risk assessment for developing cardiovascular disease. And that may include a detailed history, both a personal medical history and family history, as well as monitoring of blood pressures and sometimes lab work, including cholesterol levels, to make sure that they're being thoroughly screened.
Small steps now can make a big difference later.
Women should strive to maintain a healthy weight. They should also try to eat healthy, making sure they're getting plenty of fresh fruits and vegetables and lean proteins. Sometimes following a diet like the DASH diet or Mediterranean diet can be helpful in those situations. And they should also try to maintain a regular exercise regimen.
And doctors say it's not just preeclampsia. Any pregnancy complications can raise future heart risks.
So knowing that, we know that those patients should definitely make sure they have a primary care doctor that's monitoring for development of cardiovascular disease, that doctor is aware of what they went through in their pregnancy and that they take that into account when assessing their risk.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
Do you have a health question for a medical expert? You can submit a topic for our Ask the Expert series on WSPA.com.